Hey guys, Dr. Michael Derry here. So what you're about to see in this video is about the 7th treatment of somebody who's been having leg and back and hip stuff for the past 4 years of their life. And so anytime that they would work or do things in their daily life that would require those areas to be a little stressed, she would have discomfort for a long period of time. And at her 7th visit, things really started turning around. And so when I'm treating patients with sciatica and other type of stuff going on, it gets a little tricky at times. And what we were able to find in this client is that after those first few visits, she really started noticing a difference. And what you are going to see in this session today is how I treat the nerve, how I move the nerve, and then how we strengthen the system around the nerve to help improve resiliency. And I know she is getting towards resiliency because she says some really key things there in the very beginning of the video, in that when she does have discomfort, she knows what to do to make it better. And she's not fearful of doing the things in her life anymore. And so as a doctor of physical therapy and I'm treating her at her work, those are the things that I really want to hear. That's how I know people are getting better. She doesn't have to rely on medication. She isn't propping her leg up at the end of the day. She isn't avoiding things that she wants to do. She knows her body. She's learned a ton about her body. And despite having sciatica, some right hip stuff, some low back stuff, she's moving towards resiliency. And this treatment is amazing. It is not one size fits all. It is not a quick fix, but what you notice is that the improvement over time is building. And I only see this gal about once a week, if that. And what you can tell by her doing her homework and us really dialing in on our body, she has made awesome improvement. And so you're gonna notice a few key things during this session. I want you to pay attention throughout. You can see how it's all packaged together. As a physical therapist and someone who treats this all the time, we start off with some good hands-on work, then we move into mobility, then we move into strengthening. That tends to be the 1-2 punch. The 1-2-3 punch for sciatica and type discomfort, relieving pain, improving the system, teaching you how to manage yourself. Man, it is amazing. I couldn't be happier with this client's improvement, and I hope you guys find this video somewhat interesting. I know it can be a little dry watching it, but look at the chapters or watch the video, leave some questions in the comments section. I want to engage with you. I know no one person's sciatica is the same. And unfortunately, some people need a little bit more TLC. And this is what that looks like. This is what absolutely evidence-based TLC looks like. And so keep those things in mind as you're going through and watching the video. These are some of the top things that I like to do for the treatment of sciatica. You're going to want to watch this. Let me know what you guys think. Alrighty. So give me an update. How'd you do after last time?
I did better
Yay.
than I was 2 times ago. It's not nearly as sore.
I told you the first time is always the worst.
Tuesday was my harder day on the floor, and I did a lot more of the repositioning and the penguin types positioning to try and get more comfortable. For one, I actually just sat in a little chair and let the child be on the floor, which is not typical for me at all, but I was like, I'm going to save myself today.
Okay. Because of the right hip, you think? Okay, yeah.
Weekend was good.
Good.
No chores around the house, so nothing that aggravated it. It was pretty late.
Aggravated the sciatic stuff? Okay,
yes.
good.
I
Good.
feel like this past week was a pretty good week.
Yay, good. Back stuff okay?
Yeah, I mean, nothing's worse.
Well, yeah, I would hope nothing worse.
I think I'm getting smarter in how I'm moving my body.
Yeah.
I think I'm definitely stronger.
Yeah, sure. Stronger, how can you tell you're stronger?
Even if I sit down in like a squatting position, I don't have discomfort. Like I'm able to go, like even just doing that.
Yeah.
Like I'm more comfortable
than
I used to be.
Good.
Or at least this past week.
Sure. So over this past week, have you had any leg symptoms?
I have it right now, just tightness.
Oh, tightness, okay.
But my hip feels good right now, and so does my back.
Right hip feels good, back feels good?
Back feels good.
Okay, very good. And today is our, I think 7th or 8th total visit?
Yes, somewhere around there.
Something around that. So have you noticed, what ways have you noticed you've improved over the past, it sounds like almost 6 weeks or so, 7 weeks?
Like I said, I think I'm stronger.
Yep.
I think I have strategies now that I didn't have before.
Bingo.
And that's the big thing. I know that some of this may not go away, or I may aggravate it more or have moments of aggravation. But I feel that I have something to get me out of it.
Yeah.
Like I haven't popped in a leave.
Good.
Since I didn't do any leave last week, I don't think, which is good.
And that's typically for your hip? Got it.
Yeah.
Okay. So if you had to say percentage of improvement in regards to your left sciatica stuff, what would you say?
I have not gone home and had to put my leg up.
Okay.
In a while.
Good.
Yes. I mean, for a long time, it was get through everything I needed to get through so that I could lay on the couch and get off my leg.
Got it.
And I can't even tell you. There's been times where I'm uncomfortable and I might do the glides to get find the comfort and then chill. But I'm not in that that discomfort that I can't get out of.
Great.
I would say hip and back is less. I don't know if it's a combination of increasing strength and overall awareness of my side.
Got it. Got it.
Change different they are.
Yeah.
Or if it's putting more effort into trying different positions when working.
Okay.
And also where I know that you've been to the house, the pond in the back.
And then do you feel like you're going to be able to do it but be sore afterwards, or just... Okay.
But that's been my philosophy this whole time.
Okay.
I mean, you got to do it.
Got to do it.
Yeah.
Got it.
But I do feel, got to do it, going to be sore, going to have a leave, going to have to be sore for a while is not, I do feel like I can get out of the soreness. I feel like I can do things that are going to prevent elongated discomfort.
Got it.
Does that make sense?
Yeah, totally. Yeah, I always like to get your perspective and how you feel like your body's going to respond to the things that you want to do or have to do.
Yes.
Yeah, and so I see improvement in certain areas, but I like to see how that improvement translates to your life.
Oh,
and it's good to hear those things, and that the severity and the intensity, whether in that moment or the pathway to recovery, how much faster that is as well. And notice that a lot of the stuff that everybody deals with ebbs and flows throughout. It's never, it's rarely ever gone and gone forever. Right. It's usually, if it starts to show its face again, you know what to do to improve it.
Which was the goal.
Yes.
I mean, it's been 4 years of this. So knowing that there's things I can do to decrease.
Yep. Good.
Was the goal.
Yeah.
So.
Yeah, moving you more towards that self-management, but doing it intelligently for your body.
Yes.
Okay, so I want to check your range for your sciatic stuff. We're going to go over the nerve glides. And then, I think we're just right at that loading time now of hey, the hip is doing better. You're getting smarter in how you sit on the ground with the kiddos. Yes. And that is not a compromising position of the hip, but for what you have, it makes the tissues closer together that can get irritable. Doing the hip flexor stretch is huge, right? And so we're going to do that as well, but we just got to continue to make you stronger.
Yes.
All right, we'll test the range on the left side here. Good. And what do you feel?
Right there is where I feel the tension there.
Just hang out there. I want to see what that is. Don't want to lose that measurement. Okay, so that is 35 degrees of... sorry. That was the wrong measurement. 35. So that would have been 90, 10, 20, 30, 40, 50, 55 degrees. So that's really good.
That's really good.
Yeah.
Usually I was thinking in that 30 when we started.
Yeah. Even below that, way to go. So that's good. So we're going to go ahead and do the self-management now.
Yep.
So the self-management, kicking out the leg, the seated slump, which is amazing for this type of what we call in the therapy realm the old and cold nerves, and that you've had the discomfort for a while. Cold means that they're not really irritable. They don't stick around and give you pain all day long. So when you've had it for a long period of time and you're good at guessing when you're going to have the discomfort or not, the slumps here, the tensioners of the slumps do really well for the sciatic type stuff. And it's good for everybody. So are you intentionally not pulling your toes back right now?
Yes.
Okay. That's your call.
I think it's a little tight.
A little tight to just do it all at once. Totally.
Cool.
Totally, yeah.
Now, Am I rolling and pulling at the same time, or am I pulling and then rolling?
You want to be systematic about it. So you pull, then you roll. But it's all based off where you are for that day, right? And so, I mean, we can even get crazy enough too to alternate sides to really just loosen up the sciatic nerve both ways.
Gotta get more pulled out, because right here I'm like so apprehensive about
Yeah. Yeah, it's interesting. It's so nuancy and so different person to person, but like if it were more focused at your back and not down your leg, then doing it on the non-involved side or the right side for you would be really good, because you can just loosen up the back and then go for it.
Right.
But I like teaching you all of the ways so you can kind of pick where you are for that day and that moment of like, oh, do I want to include that or not include that? And what's really cool is just with this sciatic type discomfort, we've really dialed in the predictability of your body.
Yes.
Of like every single time we do this, you loosen up and you feel better. There's never an adverse event. It is always loosening up, and that over time will definitely get you where you want to go. Yeah, that leg muscle, right?
Yeah. It's like,
and last time we included the side planks. Was your core sore at all?
it wasn't.
Oh, okay.
Shocked.
Okay, because you were shaky a little bit.
I was real shaky.
Well, good.
Yes.
Good. Yeah, I love seeing that strength improvement. And we did the single leg squats again. And you, in the lateral lunges, yeah. And you weren't nearly as sore as you were the first time.
2 weeks ago, I was cussing your name.
My ears were ringing.
Yes.
Good. I don't know what rep you're at, but how are you feeling?
I am still pretty tight. Yeah.
Okay. That is a-okay. When you come down to the resting position, do you have any symptoms?
No.
0. Okay, so it's improved in that you don't have any resting symptoms.
I mean, if it's like right there is where it feels tight.
Okay.
It's kind of on fire right now, so it's hard to say if it's resting symptoms or not.
What do you mean?
Like,
what do you mean on fire?
I have no feeling ever on this side.
But you feel it over there?
Yeah.
Okay, so let's lay down. Let me get after it then.
So let me ask, if I'm super tight, like just now, is it best for me to do like toe up a couple times and then add the roll?
Yes.
Okay.
Yeah. I would say adding the lumbar movement always takes it up a level. And sometimes you may not want, no, it's okay. And sometimes you may not want to take it up a level.
Okay.
Scoot this way a little bit. So I'm going to get after it now, okay? So this is going to be really where you feel it. Oh, yeah. And you could just be tight today. So if you've been sitting a lot more.
I've been sitting a lot today.
Okay.
Yeah, I haven't had any treatment, any kiddos today.
Got it. So I'm just going to work on the sciatic nerve, comes from the back, goes near the hamstring, blah, blah, blah. I'm just going to work the hammy here for a second before I start biasing the nerve, just to prime the system here. I always love seeing the different faces that I see. Ooh,
Yes. Like that one's bad, but when you come this way, it's like, oh,
totally.
that's not bad.
Yeah. So out here is definitely more hamstring focused, 99% of the time.
And this is how I end up when I was having to take the leave and lay on my back on the couch. Like I was up at like a
that's
over the back of the couch to try and stretch it before we started.
Yeah, and so that's tension off the nerve. And just feel the resistance difference. Like there, I feel like I can keep going.
Yes.
Now you just get a bigger stretch. But when I come here, like I'm already feeling it there.
Yeah.
And when I add those toes, then you really start being like, oh, Michael, like that is my stuff. And this will loosen up. But again, since you have an older and cold nerve issue, I'm okay getting into it because I'm not fearful of making it worse. Now, when people have severe pain down their leg, I would always start out here and make my way in because I don't want to make their nerve angry.
Yes.
And today you are a little stiffer today.
Yeah.
We'll just loosen her up. We'll get going. So, but if you were on your own and I wasn't here, then when you go to do your exercises and stuff, it's okay doing more reps than normal. Okay. Because you could just, there's no limit on that. There probably is some sort of ceiling, but we just don't know it yet. Okay. Like, I don't know. Ooh, you're gonna feel this a little bit.
Yeah, that's right in my calf.
Yeah, hitting that big old nerve. it's so crazy. I could feel the resistance in your foot. That feels like nothing now.
Doesn't hurt.
Yeah. I'm gonna come over here. I'm gonna give you that big old stretch.
Oh.
Just waking it up. I'm coming off of it. Go back on. Breathe. Say hello to your nerve. Ooh, there we go.
Oh, there it is. Oh.
There it is. Good.
Can you feel that in my leg?
I can feel it in your foot.
Okay.
Yeah, I can feel it in your foot. It's just so interesting. Like,
yes.
when we work on figuring out different type of end feels, and so like end feels is like, what restriction do I feel at the end, and what does it feel like? Where this feels like bouncy, like a muscle, like maybe a muscle down here. But when I tension up the system and I come down here, it feels like your body's telling me no.
Yeah.
You know? And so that's why sometimes I'll come up here and I'll do the tensioner. I'm just gonna hang out here for a little bit. Since you've progressed really well, the tensioner can help relieve symptoms a little faster.
Okay.
But we just gotta hang out there for a bit. So that's what
Is that something I could do with my strap?
You could.
Or maybe I shouldn't.
You could. There are some more advanced nerve glides. I really think the seated stuff is your answer because how convenient it is for you.
Yeah. Well, even on those evenings, I think I've told you, like we were doing family movie night several weeks ago, and I was so uncomfortable, so I laid down and did my glides because I just could not get comfortable.
Yeah. Yeah, the rounded posture in a super soft couch can make this a little sticky, you know? Right there. We're just gonna hang out here for a moment. We're doing the prolonged holds today because you're ready for it.
It is burning.
I know, that's that muscle. Now, sometimes that burning goes away when I hang out here. Just breathe into it. This is when it can get tricky treating on your own because 99% of people wouldn't do this and hold it here if it felt like that.
Right.
But sometimes moving past that little threshold or that barrier can take you to that path of recovery. Yeah, we're gonna hang out here and hang with me, Jill, right there. Breathe, breathe, breathe. Any tingling anywhere? Just burning? Is it lessening as I hang here, or is it staying about the same?
I would say it's lessening.
Okay.
But it hasn't turned off like it did.
No. It won't necessarily turn off. Maybe it will though. I've seen it happen. Especially when you got me pulling on you a little bit more. You're almost done here. Shake it out. Give that hip a good stretch. Get that nerve a good stretch. You feel that? All right, go ahead and sit up. Let's see how that feels when you go to test it again.
Oh yeah. Much better.
Good?
Yeah. I was stopping about right there, but now I feel like I can
get it out there. Okay, very good.
It's not as smooth, but
That will only get better though.
definitely not like it was when we first started today.
Good. So the supine with the hold is really good. Okay, very good. Now let's move. So we'll get to the strengthening here, and your back's been feeling pretty good. Good. So because all of the exercises we're working works your back strength as well. That's good. Okay, so we're gonna package it up a little bit today.
Okay.
So we're gonna run through. We're gonna try to hit those markers. So let's loosen up the back first. So let's go ahead and get into our hands and knees. We'll hit the prayer stretch for maybe 5 reps, 10 reps max. Just judge off your body. Get whatever you can out of the stretch in the lower back. Go down to the prayer. Relax your head down. About a 3-second hold, and then come back up. Now that you're progressing more towards independence with all of this, let's say today you are a little more stiff than normal, and so every time you come down here, you're loosening up and loosening up. You know, if it takes you 5 reps to get that complete improvement, okay. If it takes you 10, that's okay as well. Okay. But you just judge that dosage off of your body for that day. So let's say Jill just got done working in her pond for 3 hours outside, cleaning it up.
So looking forward to that.
Yeah. So you may be a little stiff and you may need to be able to do 15, 20 reps with this. Okay. Whereas if right now you're like, oh, that feels pretty good, then I can just move on right to the cat camels. Okay. And you can go from there. The mobility work before we load up your body is really good. The big toe been treating you okay?
Yes.
Good. I love the spinal mobility here. You're getting a lot better of that motor control or the articulation of your spine here, the head up, butt out. You're getting a ton of good lumbar movement, and then coming back, you're really rounding out that lumbar spine as well, which is just a good place to be. Feel good? Mm-hmm. All right, we're gonna add a new one today, thread the needle. I don't think we've done this one before. You're gonna be on your hands and knees again. Okay. So we've mostly been working into flexion and extension of the lumbar and thoracic spine. Flexion extension comes from the prayer stretch or child's pose combined with the cat camel. But now we're gonna move in and we're gonna reach that right hand through and underneath this arm. Turn with your head too and reach down this way. And you're gonna feel a good stretch through here and then come back and then do the other side. Yep. Good. Don't let your jump. Oh, go ahead.
Is it okay if my hips drop?
Yeah, absolutely. Yeah, you'll dive into it. Get some more there. Yep. Yeah, so you may feel some stretch here and here. Yeah. And back to the other side. Just for 1 second. Really. Yeah, really reach. Yeah, really reach. Yep, keep going. Good. That rotational mobility feels really good for backs. Yes. Don't let your giant ring scratch my table, okay? Although this table gets beat up.
Sure.
It's good though, it holds up. I get about a year out of each one, so it's good. And this table company is really nice. They're really good. Feeling good?
Yeah.
We'll do about 2 more each side. So now we've worked in that flexion, extension, then we're gonna work into rotational mobility, which is exactly what we're looking for. All right, awesome. So we're gonna do mostly standing stuff today, but I want to do a couple core strengthening and lower back work on here. So that's the side plank. Okay. We're gonna review your form there. So remember, your knees are stacked, your shoulders or your elbows underneath your shoulder. Yep, and you're just gonna come on up. Very good. Shakiness was there before. Yeah. What do you feel?
It's hard.
Oh, it's definitely hard. Yeah. And how's it feel in your body though? Like, do you feel muscle working? You feel good?
Yeah.
What do you feel is hard about it?
I feel a lot of pressure in the right hip.
On the side of the hip? Mm-hmm. Yeah, so the plank is actually a really big strengthening exercise for your lateral hip muscles. And so those do give your back.
Closest to the table.
Yes, that's right. Yeah. Sneaky hard on that one.
Yes.
Come back. Yeah, I just read a really cool study when they looked at EMG activity for the glutes, so how much the glute fires during exercise, and the side plank was one of the biggest ones.
Oh,
which is interesting.
I'll get a smaller butt.
What's that?
I'll get a smaller butt.
You'll get a stronger butt. That looks really good. All right, let's try to come up. We're gonna go for a 30-second hold here. I'll time you.
I was only doing 5-second hold.
I know, but you look good, and so I want to challenge the system here. Okay. So just breathe throughout and really try to lift this part of your body up towards the ceiling. Good, right there, hold. We're gonna breathe through this. So therapists count by halves. So 1, 1.5, 2, 2.5.
This therapist does not.
We're doing good. We're only gonna do 1 set though. So we're gonna just breathe throughout. Keep going here. You have about 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, and relax. Good. Whew, you did it.
That's hard.
Do you feel the glute?
Yes.
In the core?
Yes.
Good, good. Other side.
What time are we recording? Facing that way now, okay. Facing this way.
Yeah, that's fine. Yep.
Aniston.
All right. Up. Good. Breathe. We're gonna time this one here, 30 seconds, which is good. You're capable of it. Keep breathing here. Yeah, good gap there. You're so much better at this already. Did you practice this? Yeah, good. Look at that, good patient. And 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, and relax. Good. All right, so we got a little.
It doesn't hurt. That one, when I go this side down, it's discomfort, not pain, discomfort.
Yeah. So that hip stickiness you have on that side, it's sometimes that lateral glute doesn't like to fire as much.
Yeah.
So it means it's all the better for you to do.
Okay.
Right, it's really good. Okay, so now we're gonna package our standing stuff in a little different way to be a little more efficient with our time. Okay. So we're gonna stand up. I wanna go over what's called an RDL first, so the Romanian deadlift. And what that does is it helps strengthen your glute and hamstring at the same time. But it is also a secondary nerve glide, which is interesting because that foot is fixed. And so we're gonna bend over like this and come up.
So similar to the one-leg skater, but
the one-leg skater squat, you're coming down into it. This one, you're staying, the knee is not bending and you're reaching forward. I want you close to the table because what you want to feel is your hamstring fire right there. Come up. Now, same thing you just did, but your right hip is opening up. I want you to not let it open up.
Okay. So am I kicking too far out?
I'll guide you through it. Okay. Slow and controlled. Ooh. There. Feel the hamstring? Yes. Okay, come back up. That's what you want to feel. The first one, your hip opened up all the way here. Exactly. Okay, so there.
So it's staying parallel?
Yeah, yep, you can say that. Yeah. There you go. You feel that hamstring fire? Good. Do you feel that into your calf?
I do.
Yeah, so that's the nerve. So this is a more advanced nerve glide. Yeah. Bingo, you got it. Good, you have 6 more just like that. Ooh, this is really good stuff. Right, not only is it good for your hamstring and your nerve, but now we're getting some really good lower back strengthening as well. Good. I love it. Very good. Now this makes people sore in their hamstring. It's an eccentric movement of the hamstring. So I would expect for you to be a little sore into the hammy. Yes, yeah. I think that was it. Okay, switch sides. Remember the same thing with your hip, and I'm very curious what you're gonna feel, the difference you're gonna feel here.
I mean, this doesn't bother me at all.
Okay, very good. It looks good. It looks really good. I'm not really concerned about how high that back leg goes, as long as you can feel it into the right hamstring there. 3. We're gonna 7 more. Look really good. Really, really good. One of my favorite exercises to do, very underrated, very functional, also called like a golfer's pickup.
Ooh, get higher there.
Feel it?
Yes.
Okay, so now we're gonna go right into the lateral lunge. We're gonna go 20 total, 10 on each side. Okay. And if you get warm, you can take your jacket off and you're just gonna keep going here. Good, your form is spectacular. You're getting great hip movement. You should feel those buttock muscles firing.
Yes.
See how much smoother you are with it now? Like you've developed the motor control, you've learned how to do this movement, you know what you should feel throughout the movement. It's perfect, perfect. Length and strength. It's one of my favorite combinations. Lunges are just amazing, amazing exercises. It's just so efficient, so effective. Right, so I always try to strive for that guideline care, so shooting for that 15 to 20 minutes of bettering our body through strengthening, resistance training, cardiovascular work, because that's been shown to kind of move the needle towards a longer, more functional life with less comorbidities along the way. So it is the goal. You look good. What number are you on?
This is 17.
I love it. See, don't rely on me. You'll end up doing it forever. Legs feeling good? Back feeling good?
It's doing okay.
Hip feeling good? Great. Now you're going to go right into your single leg squat now. We'll do 10 on each side here. Let's see that form.
The same thing we call the skater one, right?
Yes.
Okay.
Yep. Skater squat, single leg squat.
Why does that not feel right?
Because you're trying to do a little bit of the RDL with it.
Okay.
So do a little bit more knee bend
Okay.
and sink down into it. Don't worry about bending over as much. There. A little more knee bend. You don't have to touch the ground. There. That's good. That's good. And right there. Good. Okay. This is where it's going to get a little tiring because you've already done the lateral lunges. You did the RDL. And now we're hitting that one-legged squat. A little more knee bend if you can. Good. Good. Feeling that warmth coming in.
That's 10. And then I go
10. That's it. Yep. Other side. How's the balance feeling with it?
That turn was a little woo.
Yeah. A little more knee bend. Don't be afraid to bend those knees. Good.
He doesn't want to bend.
I can see that. Yeah. Try to focus on sinking down towards the ground. There you go. You don't have to touch the ground. That's not the goal.
Okay.
The goal is to get some knee bend. Feel that quad firing up. Right there. Come back up. Yes. Good. That quad strength is still important. Even though I love strengthening the hips and the hamstrings and the glutes, that quad strength can't be forgotten. Feeling good? All right. Woo! All righty. So we went through everything. Those are all great strengthening exercises. Now we repeat. So now we're going to do 20 lateral lunges, and then we're going to go right into the single leg squats again.
Oh, but not the RDL.
Not the RDL. Nope.
Okay.
We're just doing one set of the RDLs today.
So 20?
20 total, so 10 each side. That was a squat. You bent both legs. There you go. You did a great squat. Yeah, great hip mobility. Hip popping is very normal throughout. Even when you're stepping, some people get hung up on their toes pointed forward, but you're going to have that normal pointing out. Like that's just your hip, especially on that right side. Feeling your body working now? This is that strength. You look good. I'm a proud PT today. You look really good. Good. Good thing you have very flexible pants on.
Yeah.
It's good. Now you have a tomorrow's your long work day, right?
Yes.
I have a feeling you're going to be sore, but your discomfort should be good. This last set's going to be the challenging one. Okay, so we're gonna dig deep for this last set of single leg squat, and then we're going to test the nerve gland again. Okay, so 10 each side, single leg squat. Remember, focus on the knee bend. Let's give those hips a little bit of a break. You just worked them really hard. That was perfect. You feel that quad firing up? Things feel shaky?
Yeah.
Good. Remember, the goal is not to touch the ground. Like, you don't have to touch the ground here. I just want to see some knee bend. Make sure you come up all the way before you put that other foot down. There you go. I'm going to be a little bit more sticky on the form because I want you to get the most out of it you can. If you're already spending the time doing it, let's just make sure we get everything we can out of it. You look good. Feeling a little weak?
Yes.
I could see that little bit of shakiness coming out of there.
Come up.
Yeah. All right, very good. You're in the home stretch here. 10 more. Left side. Your left-sided form looks really good. And when that when that right hip is a little sticky, that's what you're going to feel the difference there.
Okay.
Because remember, when we come up into flexion for that right hip, it gets challenging. With that left hip flexion is much easier, much better. You're going to be able to move mountains.
Yes. I'll focus.
That's right. You look good. You look very, very good. Good. You look awesome. You're going to tell Cass I beat you up?
Yes.
You look good.
I feel like I can get up so much better on my left versus my right.
Yeah, you probably compensated for the longest time on that right side.
I didn't even know it.
And yeah, until we get into the single leg exercises, right? And you can really tell the difference.
Yes.
That will continue to get better. Let's go ahead and have a seat. Great job, by the way. I know that was hard work, but you made it through and it looks good. Go ahead and kick that leg out for me. Let's see how that sciatic nerve is looking. Feeling good? Mm-hmm. Awesome. Good. So between your nerve... Awesome. That's such good news. So between the nerve glides and the RDL and then going right into the single leg hip strengthening,
yes.
RDL, lateral lunge, single leg squat, it's all hitting unilateral, and we're able to loosen up your back and your nerve prior
yes.
and walk out of it feeling pretty good.
Now, is this where I would then do the stretches, or would I have done this before?
So give me an example of your stretch.
In regards to the prayer.
Oh, before. Yeah, okay. Yeah. You want to warm up your back. So the cat camel and the prayer, like
yes.
that's good spinal mobility. You want to do that before, but like we introduced today, you have your option of like how much you want to
yes.
do. You know, that 5 to 10 is a great place to be. If your body needs a little bit more, just listen to your body. If you
okay.
feel a little stiff and you know what your body feels like.
The needle one?
Yes, I'm going to add the needle, and then we're going to add a few more seconds with the side plank,
okay.
but nothing else. Everything else looks really good.
Okay.
And that we have seemed to come down to that perfect little program for you of like enough to get you stronger and better,
yes.
But not too much where you can't incorporate it throughout your week.
Yes. Okay. So when you say more to the plank, like I'm holding it longer?
Yeah.
Like 30?
We're going to shoot for probably 15.
Okay.
Now. Yeah.
Okay.
But, you know, I might frame it in just a total time wise. And
okay.
so I might tell you to do, 60 seconds worth. If you want to do 2 30-second bouts, then go for it.
Okay.
If you want to break it up, you can too. But I just want you to push yourself a little bit.
Yes, because I was only doing 5 seconds.
Which is a great place to start.
Yeah.
Because the first time we did 5
yes.
seconds, it was just where you needed to be.
Yeah.
But now you're getting better, right? Those muscles are firing more. And I would expect that right hip just to enjoy the ride, right? It's gonna continue. Yeah. It's just gonna continue to get better. It's gonna continue to get more mobile, especially with the unilateral activities. And that's where you kind of need to sit for right now.
Okay.
So good. So nerve glides look good, hip looks good, back looks good, your strength is improving. It's everything we wanted.
Yep.
Any other questions?
I don't think so.
Good. That was like kind of a picture of what the strengthening should feel like in about 15, 20 minutes.
Okay.
Right? Just getting after it, knowing what you're going to do, not having to rely on, like, you'll get better on not having to rely on your program.
Yes.
Like, once we have that established, and then it'll just be quick and ready to go.
Now, am I still at every other day for those, but every day for the glides?
I would.
Okay.
I would, especially on the days like tomorrow, right? Tomorrow you may be sore in your hips and legs where you every other day you don't have to do the strengthening, but you want to do the glides and you want to go from there.
Yes. Okay.
Yep, I would do that. So I'll update the program and we'll just keep going.